Okay, done. Lovely. Thank you very much. Okay, everyone. Thank you for coming. It's a lovely day. You can't go to seaside yet. Let's sit straight. Good morning. Om Jai Mata Di, Jai Shri Krishna, Jai Shri Radhe. आइए सीधा बैठिए. Next state, spine straight, shoulder behind. मन सहज, आंखें बंद. Go on breathing from the nostril at your own pace. Think positive, think of the divine, the lovely festivals we are having one after another. Some of you may be going to India, to Vrindavan, Barsana, Gokul, Nandagam. This is a month of Holi. Holy. That is, I am for you. Holy. Go on breathing. Relax your body and the mind. Lift up your spine. Eyes are closed. Hands are in Dhyan Mudra. Now we will start our prayer. Mukam karoti vachalam pangulam langute giram. Mukam karoti vachalam pangulam langute giram. Yat kripa tanham bande Paramanand Madhavam. Yat kripa tamham bande Paramanand Madhavam. With the blessing of our Lord, whatever we believe, our Guru, even the person who is speechless can talk. And the person who can't walk for various reasons, maybe paralysis or injuries, they can go up the mountain. So that's what is happening with us. With the blessing of our Lord, we are talking today. Who is talking? I'm not talking. He is talking. So this is what, with this good thoughts, we'll start with the blessing of our Lord, our Gurus, our lovely friends, our relatives. So go on breathing from the nostril, chanting the word Om from the mouth 3 times. Om. Bhargo devasya dhimai diyo yona prachodayat. Om sarve bhavantu sukhinam sarve santu niramaya sarve bhadrani pashantu ma kashchit dukh bhag bhave. Om Shanti Shanti Shanti. Let's all pray to Almighty with the wellness of whole universe. Everybody should be healthy, wealthy, enjoy prosperity. Nobody should suffer from any ailment, whether that is physical, mental, spiritual, social, emotional, and financial. Keeping in mind the people suffering in Ukraine. It's terrible, isn't it? Poor thing, all refugees are going. That reminds me of 1947, when we had partition, India and Pakistan. Poor refugee. But we didn't understand because we were too young. Now we know what does refugee mean. So with all this good thinking, we'll start our session, yoga. Keeping in mind all the precautions. This is very important. We all know yoga is very simple, very innocent. Anybody can do, any age, any color, any creed, any religion. But again, there are some, conditions you have to observe. I call it term and condition of the yoga practice. First of all, do as much your body allows you. Don't overdo it. If you start having pain anywhere while you are doing poses, just stop there and then. Though we know pain is our alarm clock that tells us that something is going on. But again, please don't carry on. Hypertensive, heart problems, severe acidity, severe asthma, severe backache, please do it slowly. And when we do the poses, we call asana. Don't bend forward if you got heart problem, severe hypertension or very low blood pressure, or you are suffering from backache for any reason, whether that is your osteopenia, osteoporosis, that is brittle bones, don't bend forward. This back is very, very important. And then when we are going back, in some poses we are going back also. Don't go back if you are suffering from hiatus hernia or ordinary hernia, which is a big size, or you are suffering too much acid reflux, or you have pain in your abdomen for any reason. Can be peptic ulcer, gastric ulcer, maybe severe colitis also. So please keep in mind all these precautions. We go on repeating, So today's topic is a lovely topic, as you all know. To get good health, what we need? We all know that for healthy living, we need 5 things. Yes? 5 things. That applies to any condition you are suffering. That applies to any condition. Everything works together. We say yoga again. United with everyone. Those 5 things we all know is balanced living. Then coming to acupressure, yoga, Ayurveda, and naturopathy. That's what we are doing for any condition we are suffering. But again, you try to focus more time, like I will say, on pranayama, some step you focus more what you are suffering. Goes for the asana also, naturotherapy also. So this is very important. These 5 things go together. Go get healthy living. We all want to be healthy. We say that is our birthright. And we are doing quite well. Yes, we are. We can clap for ourselves. Yes, we are doing well. The coming to constipation, which is a wide subject, and it is very, very common even. Anybody can suffer at any age. Even the baby, they are suffering. And the mother is panicking. The baby is not opening the bowels. What's happening? There are so many reasons in the children. Then adult life. And this is a golden age. Senior, they are suffering more because according to Ayurveda, constipation occurs when you are suffering from Vata dosha. Too much wind in your body. That is well known today. Like joint pains we are suffering from constipation also. And what is the definition of constipation? When we will say that you are constipated or I am constipated. When you don't open your bowels less than 3 times per week, and your stools are very hard, very smelly, you take long time to defecate, to throw them out, and you get a lot of pain also in the abdomen. That is the definition. Less than 3 times bowel movement. Some people suffer just short time on and off. Then again, depending upon what they have done, what they have eaten, how much exercise they have done, some suffer from chronic constipation. Even you can know from the face the person is constipated. Horrible face, edgy, irritable, always feeling low. And there are so many causes for this, why it happens. Like, when you have undigested food and less water intake. Then coming to your medications also. Whatever we take, nothing is risk-free, giving complications. As Swamiji stressed so much on, on the medicine, you know very well. There are certain medicines in antacid, antidepressant, diuretics, and various others. Then other thing come is your food habit and the lifestyle. The next one is hormones. Now, hormone, when there is imbalance of hormone, the example is in pregnancy, most of us suffered from constipation because of the hormone imbalance of estrogen, progestogens. And in this adult life or senior citizen life, golden life, as I say, we suffer from, anybody can guess what we suffer from? Thyroid problem. When our thyroid is underactive, we call it in medical term, mixodermia. We get constipation, we get depression, we get dementia, loss of hair, dry skin, very, very edgy, and feel very, very cold. These are the signs of our underactive thyroid gland. Now, depending upon the cause, we have to do our exercises, yoga practice, your pranayama, asanas. So we divide into 3-4 categories. Yoga, that includes pranayama and exercises, and then come to acupressure, your mudras, and then other thing is, as Swamiji says, there is no treatment in allopathy for this constipation. The only treatment is yoga practice. That includes everything, all 5 things. Yoga practice is the only one, because this constipation is stress related also. When you are not sleeping properly, insomnia, that is also giving up constipation. As we go along on the causes, I will come back again. Now going to your undigested food, how that is happening. Everybody knows. We don't spend much time on eating. It should be mindful eating. What you are eating, how much you are eating, how you are eating. So everybody says now, spend at this age about 20 to 30 minutes while you are eating. And go on chewing, because don't leave to your guts to do the work of your teeth. So go on chewing, And other thing is no disturbance, no sounds or anything, no television, no iPad, no phone, let them ring. And give full concentration what you are eating. And what type of food you are eating. Is it fried food, fast food, too much salty food, too much sugar food? So you have to look at the content of your food also and go on digesting. As Swamiji says, solid should be taken as liquid and liquid should be taken as solid. And then what else we do? Where we are sitting? Are we sitting on the ground? Which some of us can't sit. We sit on the table. Again, sit comfortably on your table and no talk at all. But again, the Western culture has taught us. The whole discussion is done on the dining table, which is bad, which is very bad. And then drinking water, we drink half an hour before or 1 hour after our meal, because this is going to give us otherwise poison in our body, creating more toxins. Plus, your Jatra Agni is cooled down by drinking water during your eating. That's another reason. But there is one condition where we say, yes, if you have difficulty, you can take sips of water. And sometimes that works better, because looking at Havan, when we do Havan, When you put little bit water on that, the Agni comes more up. Same thing, this Agni. The Jatra Agni will be more activated, but not for everyone. So this is, and some people can't even swallow properly because of the various problems they are suffering. So food is very important. Medication, check what you are eating, what medicine, discuss with your physician if you are having these problems. The food habits we have to increase now, take a lot of green vegetable, high fiber food, and various fruits also, which is going to give us water contact plus minerals and antioxidant also. There's so many foods you can talk. Everybody knows about it. The orange, the pear, the apple, and what else you can take? Melon, lot of water there also. And yogurt also is very good for our this. And high fiber, everybody knows. They're brown, everything. No maida, no white flour. And other thing is, there are certain food, we call it fermenting food, which we need. We need little bit gas in our abdomen to push our stool. They are the one like orange, prunes, figs. They are the one which munakka. Everybody knows about munakka. We soak them overnight and have it in the morning. So these fruits are helping up all the green vegetables, and drink enough water or liquids. 1.5 liter for the woman and 2 liter for the man. But again, my humble request, if you are suffering from any kidney disease, please consult your physician how much to drink, because you don't want to overload your kidneys. That might damage your kidney. Now coming back as eating, another thing coming to our Ayurveda practice. You can make better your constipation by taking this like you can do your pulses, sprouted, you can take every day, empty stomach start in the morning, that will help you. Then Loki use is very good. Loki, water gold. Juice, aloe vera juice is very good. And then avoid too much coffee and tea. That leads us to dehydration. About coffee, there is double thought about it. They say if you take 1 or 2 cups, especially 1 cup in the morning, that makes your bowels work better. Motility is increased. Lot of discussion about that is here. Nobody is 100% sure. And then other thing which we don't do, luckily, smoking. Stop smoking, drinking, alcohol. They all make you dry up, dehydration. Now coming to the best thing is your yoga and laughter yoga. They are the one to get rid of constipation. Going to the physical exercise, general one. The one which is going to do cardiac exercise like walking, jumping, jogging, swimming. These are going to help us. And rope jumping. This is very good if your body can allow you. These are the simple physical exercise. But start whatever you want to start. Please consult your physician first and then go on. Always start slowly and increase it slowly, slowly and slowly. And then try to do brisk walk also in between. That helps quite a lot. And that's why if you know that you have the urge of this, stay nearby where there are toilets, Even when you go shopping, you can come to know by the map where are the toilets, because this is very, very important. We can laugh about it, but this is very, very important. Now coming to yoga practice, what should we do? In this, we will cover first of all, the first and the foremost is pranayama. We all know the 8 steps of pranayama, out of which your Kapalbhati, Bahiri Pranayam, Agni Kriya, they are the best one. You have to do that for a longer time to get rid of this constipation. So let's start. Badrika Pranayama. Hands are in Dhyan Mudra. Lift up your spine. Give a smile on the face. Go on breathing from the nostril at your own pace, either slow or medium. No fast on the Zoom. Carry on. Go on breathing. Think positive. I am going to get better with my constipation. Do mantra inside. The best medicine is Lord's name. Any shabad, any dhun, any mantra, whatever you practice at home, at your prayer times. This will increase my oxygen level in the body. That will go to all the system of the body. And you know, oxygen is the best medicine. Get rid of any problem. The central nervous system, respiratory system, cardiovascular system, digestive system, excretory system, reproductive system, anything. Go on breathing. Badrika Pranayama. You are collecting power here, getting blessing from your Guru, from your Lord, from your friends. They're all blessing you. You are collecting energy, which we are going to use further on to get rid of our problems. संचित कर रहे हैं इस समय हम संचित इकट्ठा कर रहे हैं. Try to do this for 3 to 5 minutes. At home, you can do long time, maybe 10 minutes. Carry on. Then raise your arms up, rub your palms 15 to 20 times to generate more heat. Put them on your eyes. Feel the warmth going on your face. This is going to increase my vision, get rid of any problem coming to the eyes, watery eyes, discharge eyes, redness in the eyes. Once the temperature is normal, body temperature, open your eyes slowly, remove the hand, give a massage on your face. On the facial, you are increasing the oxygen by rubbing. Do the lower eyelids. We have got problem here. Some people got little bit swelling there, puffiness. And black patches also. So go on rubbing like this. The lateral angle. Very gentle, the medial angle. Very gently. Over the eyebrows. Come to the temple region. There's a big nerve there, temple, artery and nerve also. When they get inflamed, lots of problems. Take away the tension also. Do your forehead with medium pressure. You are here, if you press, you are activating your pineal gland, the third eye, Agya Chakra. Then do like this. You know, there are so many sinuses. Here is the frontal sinus on the forehead. So we want to get better there also. And the rest of the sinus is like this. Many people are suffering from sinusitis. Sinusitis, blocked nose. So do like this. Very good. Over the head, coming down like this. You are activating your vagus nerve, producing more nitric oxide. Already you started doing production of nitric oxide. When you started with the Om chanting, the Badrika Pranayama, go down to your throat, then down to your thyroid gland, parathyroid gland, the vocal cords, and come down here. Go to the thymus gland. Very good to take away any anxiety. This constipation giving me so much anxiety. Why can't I open my bowels? Very anxious. So that takes away that. Plus increase the immunity because the T cells. Okay, rest of the body you can do. Now we are going to move over now. The next pranayama is most important for the constipation. Do it at your own pace. Do it at your own pace. Now keeping in mind more precautions here. After major surgery, 4 to 6 months, please don't do it. Even after minor surgery. Minor surgery, I would like to give example because last time when I spoke, I got few calls, Minor surgery example, simple is any simple operation you have. I give example of cataract operation. When you have cataract operation, please always consult your yoga teacher or physician that when I can start, which one I can do, how long I can do. This is very, very important. Don't ignore that. But I request my participant to come to the Zoom or the class, come and join us. Because by joining there, you're getting so many vibrations and you are uplifting yourself instead of sitting home and thinking about that operation. We have to uplift them, And then if you're bleeding from anywhere, nose bleeding or wherever the bleeding, maybe the menstrual bleeding, don't do it. If you're pregnant or trying to get pregnant, don't do it. And if you've got headache, dizziness, vertigo, please don't do it. These points are very, very important. The Kapalbhati, first I will be doing with mudras. Which mudra we should be doing for the constipation? Again, you do 1 stroke, 1 second. Everybody knows about this. You have learned so much. We all have learned so much about the mudras and acupressure, Kapalbhati. So let's start with our, first of all, Prana Mudra. Touching the tip of your ring finger, little fingertip of the thumb, rest to straight on your thighs. Lift up your spine. Full attention is on exhaling. Rechak. Purvak is breathing in. Rechak is breathing out. When we do Kumbhak, when we are holding our breath. Okay, so we are doing, our full attention is on our Rechak. First breathe in, then breathe out from the nostril. Do it at your own pace, either slow or medium, no fast, please. And give a smile. Now here you're going to give full attention to your constipation, at your gut, the intestine. They are the troublemaker, isn't it? So full attention is here. They are all over. The stomach, duodenum, jejunum, small intestine, large intestine. And when the constipation happens, they get stuck where? The left side down there. Sigmoid column, and then come your rectum down below. And this constipation is giving us lots of complications. We are getting hemorrhoids called piles, anal fissure, anal tag, anal fistula. And if you are straining too much, your rectum is also coming out, rectal prolapse. And if carries on, you will be suffering from colitis. So many complications of this constipation. So we are doing our Kapalbhati, taking my mind down on the left side, lower part mainly. Over there, the stools are collected. They are stubborn not to move from there. So do this, giving them like jerks, Move, move, and move. Motion is very important. As we say, no motion, no lotion. But again, we are saying motion is our medicine. We are moving. We are doing this movement. Go on chanting inside, Om, whatever you practice, any name. with full surrender, with full attention. Puran Sharnagati, Puran Vishwas. Give a smile on your face. And request your bowel to work properly. You have to request with love and affection. You are increasing your prana. As you know, there are 5 types of prana in the body. Here it is the upon one which is working. That works from your umbilicus down to your toe. That's what we need at the moment. Upon Vayu. To throw away all these waste products. Upon Vayu is working. You are increasing your energy, the prana is flowing. Various other benefits also, this one. Take away all the laziness. That's good for the eyesight. Well done. Now change over to Varun Mudra. We need more water in our body to make our stool soft so that they get rid of from the body. You are touching the tip of your little finger, the tip of the thumb. Carry on with Kapal Bharti at your own pace. Do for 10 seconds, 20 seconds, 30 seconds. At home, you can do for half a minute or 1 minute, one pose. Carry on. You are activating your thyroid gland, parathyroid gland also. So that will help me to get rid of my underactive thyroid. That will improve me from the constipation, get rid of constipation, because my thyroid is working well. And by doing this yoga practice, we get so much, our stress disappears completely. That's how it is working. Change to another mudra known as Vayu Mudra, because as according to Ayurveda, this is water dosha. There is defect in the water. So we want to improve that by doing our Vayu Mudra. You are touching the base of the thumb with the tip of the index finger. The thumb is resting on the index finger. And this is very good to get rid of pain anywhere. Whether that is arthritic pain, menstrual pain, headache, and going to increase my digestive system also. As we are growing up, our Jata Agni is going down, down, and down. To uplift that, the Vayu Mudra will help me. And the Kapal Bharti. Carry on with a smile. You are doing very well. Carry on. The next mudra, which is most important. Anybody? Apan mudra. Apan. You're touching the tip of your middle finger, the ring finger, the tip of the thumb. Apan Mudra is the one which is going to control my constipation, good for my piles also, and various other benefits, getting rid of all the toxins. Now you can do with your movement. Again, motion is important. Carry on, move your body according to your own stamina. You are moving all the internal organs, your chest, good for heart and lungs, getting rid of extra weight, getting rid of gas also when you are moving. Apan Mudra with Kapal Bhati. Carry on. You are moving your neck also. So you are activating your thyroid gland, parathyroid gland. Getting rid of extra fat from the neck. Kapal Bhati with Apan Mudra. Activating your liver, the gallbladder, the spleen, pancreas. We need those organs also for the digestion. So we are activating them. Carry on at your own pace. Well done. Now just relax. Take a couple of deep breaths in and out. So we have covered 4 or 5 mudras for this one. The next one we are going to do Kapal Bhati. As I said, we are going to spend more time on Kapal Bhati. We will do acupressure now. Very, very important. You know so many organs, acupressure points. But here the idea is, our protocol is just the same, only we have to spend more time on that depending upon what disease or condition you are suffering from. So we will pick up now for the acupressure point, our ball point. Our gut point is down here. You can see on the left side, we call it ulnar side. The lower part, this one. You have to press this point. Here is your main area of the gut where the stools are standing for a long time. So we are activating this point doing Kapal Bhati. So put it like this. Everybody has seen this area, you can say. This area. Press this one. You can do with 2 or 3 fingers because area is wide. So do this with Kapal Bhati. Acupressure point for the ball. Go on doing Kapal Bhati. If you can't do Kapal Bhati, go on doing Badrika Pranayama, breathing in and out.
You're doing on the right hand, right?
Both the hands. You have to do both the hands, not the right. Both the hands, left and the right. It's a large organ, you know.
Yes.
Both the hands. Very good. Carry on. Do with 2 or 3 fingers. Deep in. Put it on your knees. Or you can have that pencil if you want. The wooden pencil. And go around. See? Go around that area. On this side, not towards the thumb side, the little finger side. We call it this ulnar border, you know. So this area is the one. I'm just going around this area. On both the sides we are doing. We do with this pencil, or you can do with your fingers. Both the hands.
How long do we do it for?
How long? That's a good question. How bad is your constipation?
I haven't got that much constipation. I'm okay.
No. On average, we say as a preventive method, you do 2 to 3 minutes. But if you are suffering, you can do 10, 15 minutes.
Okay.
Because there's no harm.
Okay, lovely.
It
Thank you.
depends whether this is preventive method or therapeutic method. So if you are suffering from some condition, you have to do for longer time. As we
Yes.
say in allopathy, dose of the treatment is on the condition, severity of the condition, mild, moderate, or severe. Same thing goes to this. Our yoga practice, that depending upon your condition, you carry on. So maybe if one is suffering, let's say I am suffering from constipation, I will be doing 15 minutes, maybe 3 times a day then.
Okay.
For
Yes.
elderly, for a very old person, is it still safe to do that?
Pardon?
For an elderly person who is quite in their 90s, is it safe?
Of course it's safe.
Okay.
It is quite safe, my dear, because that is the age group who are suffering.
Yes.
That I said, the old people are suffering more than young ones because there are so many reasons. What is the reason? I will tell you that this is a very, very important point.
Hmm.
Old people are not eating properly. Okay? They are not eating properly because their appetite is not that good. So they are not having enough high fiber diet. They are not drinking water. You have to remind them to drink water. This is happening all over. In the old people practice, we are seeing somebody, their carer has to remind them to drink water every 1 hour, 2 hours, then make sure they are eating proper, healthy food with lot of green vegetables, multicolor vegetables, and nuts also. They are not. And at the moment, sorry to say, with the financial problem, even in this country, how many people are dying from hunger? Old people, because they think whether they pay for the fuel, the bills, electricity and water, or they eat or heat. They have got that either eat or heat. This is
dear.
very big problem in the old people, especially who are living alone, they are dying from hunger or they're dying of cold, hypothermia. So old people should do this provided they eat something. Now what happens with the emotions or to our constipation? Very, very important. When we get sad news, do you feel like eating? You don't want. When you get a good news, you eat more. So that depends on your emotions also. There are 2 ways when we are sad. Either we are overeating without thinking what we are eating, and we eat all wrong food. Biscuits are there in the kitchen, go on eating without thinking what you're eating. And other side, when we are happy, we eat too much. So many mithais and sweets are coming. They're going on eating. So this is the thing, emotions also play quite a lot part. That's why somehow we have to get rid of this stress. And we all are doing a good job doing this yoga practice every day, every day. Now coming to the acupressure, the next point is your chin point here. Press this one, chin. And do Kapalbhati. Carry on. Carry on Kapalbhati. The next one is your stomach. Give a good, nice massage on your stomach. Put some oil and do nice massage. You are activating your bowel activity. And you can do like this also. You are activating your vagus nerve even. Parasympathetic is activating. The heart rate will come down, respiratory rate will come down. See? Do like this. Tabla, dholak. You are doing tabla or dholak. Carry on. Ball will move, will pass some wind also. Another point which is very important again for this is, I will show you by marking. This is hand. This is the border of the hand, you can say. We are on a border. And this is the wrist starting from there, yes? So at the border, you can say this side, the thumb side is this point. Can you see black dot? This point you should press for the constipation. I've done a dot for you. The junction or the border, Ukraine and Russia border, come on here, India or Pakistan. This border, this point you check, press it, doing Kapal Bharti. Both the sides, same level. Everybody got it? Yes, you can nod your head. I can see 4 of you very easily.
What does that
Very
do?
good. You know, this is your palm. This is the bottom here. Here you are joined. You are starting your wrist. So this area here, you press for constipation. Go on pressing both the sides. Yes? Yeah. With a smile on your face, you're getting rid of constipation.
That is a pain there. In fact, what does it indicate?
Pardon?
If there is a pain there, what does it indicate?
If pain is there may be some, I don't know why pain is there. Because whatever you do, there is not only one thing getting better. There are so many things. Maybe you have got wrist problem. You have got carpal tunnel syndrome coming up. Because these points are all the carpal tunnel also. That's why we do this, and we press this like this. We press for the carpal tunnel syndrome. Because multiple problems are here in the body, you know. We do this for carpal tunnel syndrome, like this. Just rotate like this, make a circle of your thumb and the ring and go on. Or other thing, wear some chudiyan. That's why we wear this jewelry, you know. They are giving you a lot of acupressure. With the chudiyan I do. Wear any bangles, any color, lovely color. Watch out glass one in case they break, you know. Okay. The next one you all know, which is more important, your calf. Give a good massage on your calf. This is connected to our bowels. Ask someone to do it. If nobody is near, then do yourself. Lot of massage on the calf. Increase your lymphatic system. Get rid of cramps. Good for the varicose veins. And getting rid of extra fat also. So go on doing both the side, your calves with a Kapal Bharti or Badrika Pranayama. That is a must. Well done, my friends. Let's move over to now some poses. Asana, they are most important. You can do asana in any condition. Whether you are in your bed or you are sitting on the chair or you're on the mat. Mandukasana is most important. So spend more time on that. Breathe in, breathe out, make a fist and put it at the level of your navel. Breathe in, breathe out, come down like this, do Kapal Bharti. Ten seconds, 20 seconds, maybe half an hour. Not here at home. This is the one which is very, very effective. Don't come forward if there's a back problem. Breathe in and come up slowly. Second pose, left hand at the navel, right at the top. Breathe in, breathe out, squeeze your stomach nicely in. Come down.
Dr.
Now you
Kapur,
are activating most of the organs. the pancreas, liver, gallbladder, spleen, kidneys, adrenal, and the intestines also.
Dr. Kapur, if I got hernia, inguinal hernia, can I do that? Because
Which hernia you have got?
inguinal.
Inguinal.
Yeah, can I do that?
Please don't do it.
Okay, all right.
Now, how big is that, by the way?
The lump is very small. It comes and goes.
Now, what size? Pea size?
Yeah, probably pea size.
Then you will get better, but don't give too much pressure.
Okay.
You can do like this, you know. Do Kapalbhati like this. Still your hands are there.
Okay.
So this is the upper part of your abdomen. That's
Right.
not going to give any harm down at the groin, you know. So you
Yes.
should do Kapalbhati like this if it is a pea size. This will get better because the muscle will get more action done.
Okay. Thank you.
But if with hiatus hernia, is it still okay to do it?
Hiatus hernia, you don't come down. Now, hiatus hernia, when you do like this,
Yeah.
now, if you're coming more down, just look at your anatomy. Your stomach will come up.
Yes.
So you should not do. You should do sitting.
But Kapalbhati is fine with hiatus hernia.
Yes, you can do Kapalbhati. That's why the modifications are there, you know. And you have to modify yourself. Like I'm doing Kapalbhati with hiatus hernia. And with acid reflex also. I'm not coming down. Forward bending is prohibited in these conditions. No forward bending. Because your stomach will come up towards you through the diaphragm coming up into the esophagus. So that's why you should not bend forward. Even heart condition, don't bend forward. Hypertension also, I will say. Low blood pressure, high blood pressure, depending upon the severity. Don't come. You will get dizziness.
So with
So that's
diverticulitis is still fine with Kapalbhati? Diverticulitis for diverticulitis is still fine with Kapalbhati?
Colitis, now talk about colitis. Again,
No, not
severity of the
colitis, diverticulitis.
Severe colitis, please don't do it.
Diverticulitis, yeah.
Severe colitis, don't do it. Mild colitis, do it gently, slowly. And other thing is which takes time to even explain, diverticulitis, which is not uncommon. Some of you might have or heard about it. In that, you have to be very, very careful because your lining of the ball goes out and form a pouch sort of, and that can burst even. So you have to watch out that even your eating habits are changed there. You're not supposed to take high fiber food. You don't take any seeds even. You take all liquid type of food and you take low fiber food. So there are so many conditions of this intestine, you know. But in severe colitis, no Kapalbhati, not at all. Even hyperacidity, you don't do Kapalbhati. चलिए कहाँ थे हम? This is the Mandukasana, which is very, very important. Next is your Shashakasana. Breathe in, put your hand on your knees, breathe in, take it up, stretch, and do Kapalbhati. Here you are activating your abdominal muscles and the organs. Do Kapalbhati. And you are stretching yourself so that your bowels will be working better. Stay there, short time. Then you breathe out and come down towards the ground. Again, precautions, keep in mind what condition you are suffering. You can touch the ground or touch your thigh or the knee. Here again, you can do your Kapalbhati. This is your Shashakasana, the rabbit pose. Stay there for a short time, go on doing. Enjoy yourself. And you come up slowly, breathing in. Badrika Pranayama going side by side. Stretch your arms again. Look at the ceiling. Then bring your arms by the side very slowly, very slowly. Next is your Vakarasana. Take your right leg on the left. Hold your right knee with the left hand and right hand behind, close to the hip. And look at the right side. You are giving twist so that this gut is getting all that twisting also. Activating the gut. That is your intestine. And do Kapalbhati. Then breathe in and look straight, other side. Sorry, I will be moving little bit fast, which I don't like. Always do slowly everything to get the benefit. The left side we are now doing. Well done. The next is Yoga Mudra Asana, which is very, very effective. Now, Mani, you can do properly. We will do modified. Put your hand, left hand on the navel, right at the top. Actually, you're supposed to sit in Padmasana. Padmasana to do exact. I can't do Padmasana. If you can manage, do Padmasana. Hand, left hand at the navel, right at the top. Breathe in and breathe out. Go down slowly. Your chin is touching the ground. We are imagining our chin is touching the ground. If you can manage, Mani. Now do Kapalbhati if you can manage. Otherwise, go on doing Badrika Pranayama. See how much pressure is coming on your bowels. Our attention is on our constipation still. Though other organs are also getting the benefit. Stay there as long as you feel comfortable. Chin is touching the ground. Then you breathe in, come up very slowly. The second pose, which is very effective. You are still in Padmasana. I am on the chair, okay? Take your hand behind, hold it. Breathe in, breathe out, come down slowly again. Your chin is touching the ground and you are raising your arms up. See how much pressure is coming on your intestine. You can't do Kapalbhati in this one. But again, we are getting a lot of pressure from our thighs to our abdominal organs, including my intestine. Then come up slowly, very slowly. Relax. Take a couple of deep breaths in and out. Now sitting on the chair, as we are doing on the chair, many can do on the mat. Going to do lying down now on your back. You are lying down. Imagine people sitting on the chair. You are lying down. And then you do all that leg raising exercises with the arm at the same time. So much stretch is coming. I am coming with the arm and the legs. Stretch. Right. Very good. Right and left you can do. Alternate at the same time. Stretching. Stretch. Go on breathing. Our pranayama is going on side by side. Badrika here. Now rotate your legs and the arms. Arms also. Time is short. We want to use every second. Clockwise, anti-clockwise. Carry on. Clockwise, anti-clockwise. Carry on. Both the sides. Now take your legs down now. Legs down. Do Uttan Padasana. The right leg is going 30 degrees above. Raise it 30 degrees. No, 30 degrees, not 90, 30. Just little bit up. Yes, 30 degrees. 30 degrees up. Hold it. Then take it down. Take the left one up 30 degrees. Uttan Padasana. Very good for the abdominal organs, plus for this constipation also. Take it down. If you're quite active, no heart problem, no hypertension, raise both the legs up 30 degrees. Hold it. Hold it. See, I have got a stool. I am using my stool, about 8 to 10 inches height. Now you take both the legs up, hold it. Then while breathing out, take it down. Do the Nauka Asana. Very good for the intestine. Nauka Asana. Very good. Take it down. The next one is your Markatasana. The Bunder pose. 3 poses of that. Join your knees together, heel together. Take the legs one side. We can do while sitting on the chair. And look at the opposite hand. The arms are at the shoulder level. Then breathe in and look straight. Now take the legs other side and looking at the opposite hand. You are stretching nicely at your shoulder also. Then breathe in and look straight. Second pose, there's a gap about 1.5 feet between your knees and the heel. Take the knees one side, going towards the right and looking at the left hand. Now you're supposed to stay there for a short time. 30 seconds, 40 seconds, maybe 1 minute. And if you've got a lot of problem, then you should be doing for 1 minute or 2 minutes continuously. And the total duration will be 10 minutes. This is going to improve my back also. And for the abdominal organs, weight reduction. And my gut is going to move fast. Then breathe in and look straight. The third pose, take your legs up, 90 degree up, stretch, stretch. And take it, the right leg is going towards the left hand, close to the left hand. Hold it. The best pose for the intestine and for the back. You might pass some wind also. And take the leg up again. Stretch it 90 degrees. Hold it. Then bring it down very slowly. Very slowly. Other side, left leg is going up 90 degrees. Take it on the right side. And I am looking at my left hand. Hold it. Then breathe in. Take the left leg up again 90 degrees. Stretch. Then bring it down. The next one is your Pavan Mukta Asana, the best one. Do with the right leg first. Hold it close to your chest. You can bring your nose close to it if there is no back problem. Take it down slowly. The left leg up. Hold it. Breathe out and take it down. All movement is done with the Badrika. Now hold both of them again. If you're very weak, you got hypertension, heart problem, brittle bones, don't bring both together. While sitting on the chair also should not. Only put a stool in front and you can do it, as I've done. See? Stool. Squeeze your stomach. Tell your bowels to work better. Get rid of gas. Thinking is most important. Now you can rock yourself front and back and sideways. Well done. Relax now. There are many more poses you can do while lying down. You know, the difficult poses, I will show you. Here we are lying down. Try to hold you can do it, Manny. Hold your big toes and put your arms inside. The elbows inward. I am doing on my stool. Yes, this is a very good pose. These the few we have done is for Nadi Dharana also. Displacement of the solar plexus. You hold it. Bring your big toe close to your nose if you can. If can't, then what I do when I'm lying down, I hold the bottom of my trouser, but the arm should be in the inner side of your thighs. And you're squeezing. Very difficult name. Here is your nose, your big toe. This asana. Anushka, Nasika, something, big name. But this is very effective. Okay, relax. The other one is we are going to talk about Bhadra Konasana. You join your soles while you're lying down. Join your soul. I am doing on my stool as we do butterfly. I'm not doing any flying. Hold your soles together and you are touching your soul, bottom of your soul with your hand as you do in butterfly, if you can. Otherwise, just hold it at the ankle if there's a problem. You are lying down. Nana, put your legs down on the ground. Join your soul. Join your soul. Knees down as if you're doing butterfly. And join them. Here is a lot of pressure coming on your pelvic floor and the thighs. Join, look at me. I am joined here. I'm doing sitting. Just imagine I'm lying down. Just join.
I'm joining, yeah. I just got a bit of a
Join
cramp
your
there.
soul.
Yeah.
Join your soul. And
I've got a bit of a cramp there. I'm doing
other
it.
don't, because we are doing too fast.
Yeah.
Okay, never mind. We just imagine I'm lying down, holding my,
I'll
and
do it in a minute.
if you can't, keep sitting, do sitting. I'm doing sitting. Chalo,
Okay.
we are joining the soul, and here your arms are here. Now try to bring your head close to your feet. That is known as Bhadra
I can do it.
Konasana.
I can do
So
it.
much
But
pressure is coming on your pelvic floor. Bhadra Konasana, when you're lying down, that's known as Sutvadra Konasana. Like the fish pose, you know, we do fish pose. So, go on doing while you're sitting. Well done. Now lie down on your belly and do cow's pose first. Cow's pose and Cow's pose and cat pose. Here we are. Cow's pose. See? Here we are. This is my cow's pose. This is my cat pose. Cows up. This is very good for your spine also, plus for the abdominal muscles. Okay, next is lie down on your belly. I am doing it. Makarasana. Pressure is on your abdomen, isn't it? See? Take your right leg up. Heel coming towards the hip. Take it down. Breathe in. Left leg is coming up. Heel is coming towards the hip. So much pressure on your abdomen. Very good. Take it down. Coming to Cobra. That is very good. First pose. Chin on the ground. Hands are at the side of your chest. Legs are together. So much pressure is coming on the abdomen. Breathe in and look up. First pose. Hold it, then breathe out and come down. The second pose is full cobra. Hand on each other. Either you put your chin there or you put underneath your chest. Breathe in. Take it up. Look at the ceiling. Here my elbows are completely open up. That's why it's full, complete. Then bring it down slowly. You can do the third pose also. Hands at the side of your chest. Raised up little bit above the ground. Your arms are first there. Then you bring it forward as if you're flying away. Look up. Going to India. Flying. Flying. Then you come down. Next one, Shalabhasana. So much pressure is coming on the lower abdomen. Take your right leg up. Very good for the pelvic floor. For the thighs, for sciatica. Take it down. Left leg is coming up. Then come down. Now, take your hands, both of together at your waist. This will give lot of pressure on your abdominal organs. Chin on the ground, then raise it. Bring your hands down on your hip. See how much pressure is coming on your intestine. Stay like this for some time. The ball will work. Bring the hand back on your waist. Breathe in and take both the legs up and the head up, both the sides. And if you have a little bit fat on your abdomen, you get better. That will be your platform. Breathe in. Raise your legs and the head. Stay there for 1 minute and you will pass the wind and the ball will work. Hold it. Put your hand on your hips. You move from the waist to the hip. Then you're stretching your arms also nicely. Don't bend your elbow. If there's any problem, look after it. Stay there. Then relax. Relax, lie down. Go to the resting pose of Makarasana. Your head is on your hands. Legs are wide apart, 1.5 feet. Your forefoot is in and the heels are out. You are relaxing. The resting pose, as we have got Shavasana, another one, resting pose. Well done. Now I will show you what I was saying about Bhadarasana. Supta Bhadarasana. Bend your knees. Join your soul. Join your soul. Take your arms up. Sat Bhadra Konasana. Very relaxing. Very good for the pelvic floor, for the knees, for the thighs. Then other one, which is very important, is your bridge asana. Legs down on the ground, bend your knees, and lift up your spine up. Very good for the spine, plus for the intestine to work better. Hold it in the bridge asana. Setu Bandhasana. This is very good for Nadi Dharan also. Displacement of the solar plexus. Very good. Hold it. Hold it. But don't do this if you are suffering from hiatus hernia or acid reflux. Hold it and come down very slowly. Very good for the spine also. Well done. Now take the left turn. With the help of your hand, get up. Lovely. Let's see what's the time. Now you have done most of the poses. Going back to pranayama, we do Bhadra Pranayama, which is very, very important. Try to relax little.
Good morning to Navnita Yejo. Just came back from other class. Sorry. Good morning.
Good morning, Sarvanji.
And Dr. Kapur as well.
Finished it. What else you can do? Bhadra Pranayama is most important for this. We are doing 3 locks, and the third one, the root lock, is most important. So, sit comfortably. Hands are in Vayu Mudra. Take a long deep breath from the nostril, exhaling fully from the nostril. First do your root lock. Udyan Bandh comes automatically, the abdominal one. Then you can do your neck lock if there's no neck ache. Bring your chin down. Here you are holding your breath. But again, if you're suffering from breathlessness, severe hypertension or heart problem, please don't hold your breath. Then you breathe in. First, you can open your neck lock, then abdominal, and then the root lock. This is going to activate my pelvic floor nicely. And all the organs over there, get rid of any urinary problem, any prolapse, good for the prostate. And next is Agni Kriya. Breathe in and breathe out fully. Bring your stomach backward and forward. The gut will move. The gas will come out. You will be running to toilet. As many times you can do. And various other benefits also. The other one is squatting is very important. Now you can modify this according to your physical condition. Doing on the chair or standing up. Very, very important. Let's say I'm elderly and my body is not very flexible. So I am doing on the chair. Put your hand like this. Go up and down. You are increasing your nitric oxide also. Squatting. Carry on. Very good. Okay, the next one. You are quite okay. You can stand. Not that. You do your chair pose. Chair pose. See? Buttocks are coming out. Do like this or bring your spine a little bit up. But bottom should be coming outward. Then again, I have got a lot of problems opening the bowels. Deep squatting. Do your deep squatting. How you will do that? Deep squatting. See? On the eastern toilet. Deep squatting. Yes. Mani, you are doing proper. Very good. You are on the eastern toilet. Stay there. Don't just rush out. Then only it will work. Then you come up. We have got all Western toilets. But we can modify that. What other things we are doing? Our habit is not normal. Sleeping, eating is not normal. Haphazard. That's why the bowel is haphazard. So we have to improve our timings of eating, as I explained how to eat it, when to eat it, and the chewing. Other bad habits are in the toilet. We go and take various gadgets with us, newspaper, magazines. So make sure we don't do that.
And mobile phone. And mobile phone.
Mobile, yes, gadgets. Gadgets are your iPad. And one of the house I went, they had television also. Television in the toilet. These rich people, rich people. And then make a habit of sleeping at the right time, getting up. Because the bowel work by Ayurveda, in the morning, we should get up before sunrise. I know many people that sleep very late. They go on working on iPads and they get up at 9 o'clock and they are suffering from constipation. Other thing is managing your stress. Be happy, do a lot of yoga practice and laughter yoga. When you do poses with laughter yoga, automatically your bowels work so well. And if you are elderly, watch out for incontinence, otherwise you are in trouble. Other thing they are talking about sleeping on left side, how it is working. According to our anatomy, see stomach, duodenum, small intestines, coming to this cecal junction with the large one. And this is your ascending colon. Then come the transfer column. This is ascending, coming up. Then coming to transfer column. And the left side is your descending column. That is the sigmoid column and the rectum where this solid waste is staying. This has to be moved out. So that's why they say, if you sleep on left hand side, you can work better. Plus that is again good for snoring also. Disturbance of the sleep is giving us lots of constipation, as I said before. So we have to watch out all this. Now going to the toilet itself, we have got Western toilets. So what should we do? What should we do? We can improve that. Extra water we are drinking, as you know, as I mentioned before. So what should we do? You have got Western toilet. Try to raise put some block or a stool small height, not too much height. We want to correct the angle between our anus and the rectum. So this is the block I have put, or anything you can put, not very high. Near this is my toilet. Yes? Okay. I'm putting my feet there so that my knees are higher than my hips. My knees are higher than my hips. Put your elbow like this. Bulge out your tummy outside. Lift up your spine, and that improves your angle. And the fecal matter will go down easily. This is what you can do. Your knee should be higher than your hips. Put it there. Small stool, not too high. 4 or 5 inches is more than enough. So you are giving pressure. Other what we do? Going to the toilet.
Dr.
If you
Kapur,
find difficult to defecate,
Dr. Kapur,
you
this
can do
will prove
Agni Kriya you can do. And if you can massage your calves, if you can manage, if you're mobile enough, massage your calf, do Agni Kriya, and give some time. Don't rush out. Don't rush out. But again, don't stay in the toilet too long. According to Swami Ramdev Ji Maharaj, you are supposed to stay for 2 minutes. The time you take to pass water, that much time you need to evacuate. So this is very, very important. You know, we spend too much time, we stain too much, and we damage. So many people are suffering from hemorrhoids. That is the reason. Colitis, rectal prolapse. So these are very, very important points. But I mentioned.
Dr. Kapur, can I say something here?
Pardon?
Dr. Kapur, can you hear me?
Yes,
no,
I can hear you.
Yeah, what I was saying was the stool thing has been proven medically. If you put your foot on the stool, then your bowel movement's easier.
Yeah.
That's that was a very good point.
Yeah, that is well proved now. The positioning on the Western toilets, otherwise have Eastern toilets. But fortunate thing is we can't even sit like that, you know. That is a big problem with us. So this is what I have covered most of the things, I think. Whatever is left, you can ask me. Not this session, next time when you see me. On the whole, you have to watch what you are eating and how you are eating. How much time you are spending on eating, silent eating for 20 to 30 minutes. And why? What else is the problem at this age? Just look at ourselves. Half our teeth have gone. Or the denture giving another. And we are not chewing properly. That's the biggest problem. The next one, I will just now carry on with the final prayer.
Yes, can I ask one question, Dr. Kapur? This is Thakurlal.
Hanji.
You mentioned about cataract operation. The people who have got cataract operation, what exercise they should do and they should not do?
What exercise? Now let's say I had cataract operation and I have no complications, no complication. I am putting my drops, no complication. Then I will start doing very gently my Badrika Pranayama, very, very gentle. Not too long, short, small, only few times I am doing, can repeat during the day. Okay, I am still under 6 weeks, still my follow-up is not done. So I won't like to do any Kapal Bharti. So only you can do your Anulom Vilom, you can start before the 6 weeks follow-up. If there's no complications at all, then I'm seeing in the clinic, doctor say it's fine. Then slowly and slowly, I will increase the duration of my Bhadrika Pranayama, Anulom Vilom, and I leave my still Kapal Bharti for some time, maybe 8 weeks, then start very, very slowly for short time, then build up slowly, slowly and go. No Agnisar Kriya, no Bahari Pranayama, and I can do my, of course, this Udgit Pranayama, more relaxing one. I can start Anulom Vilom, Udgit Pranayama, meditation, not too much dancing and loud singing even. And as they say nowadays, they say do everything. You can do your cooking and what not. Previously, 7 days they used to keep us in hospital, but now they discharge you the same day after 2 hours. You are doing your cooking, but don't lift heavy weight. That is very important. Rest you can do it, but I think that's what I say even on the Zoom. If anybody had cataract operation, please join us in the classes. When you come to the class, you are uplifted. You are inspired by others. Though you are not doing much, but that gives us also your vibrations. And we are going on.
That's right.
So that's the only thing. If there's no complication, there's nothing to worry much about it. But go very, very slowly.
Very slowly, yeah. And the normal asanas like Manduk asanas and other asanas can...
Asana, wherever there is movement of your head, don't do it.
Right.
This area is affected. This you can do. This is known as, according to the physiotherapist, a relative movement. Not full movement, relative. Relative movements you can do. Don't do your face one. Rest you can do. Rest of the trunk, your legs, your arms also. When you are stretching up this, you have to be gentle. Because when I do this motion, this will affect some part of my head also. So try to avoid that particular area and the surrounding area. Rest you can do all.
Yeah. Oh, that's good. So it's very,
so
very...
many asanas we have covered today.
Yes.
So you can do most of the asanas. I didn't do your neck movement, neck exercise, no. So this you can avoid because that wasn't beneficial for my bowel, that wasn't affected. Only my stomach is the one, the pelvic floor is the most important because those organs are there. Intestines are there. Last part of intestine is on the pelvic floor. So you have to do those poses more. Our protocol is just the same, only you focus more on the problem. Backache, headache, heart problem, hypertension, whatever the problem is. Luckily, Swamiji's made such a lovely protocol, easy to follow.
Yes, yeah. And thank you very much, Dr. Kapur. Very, very good information, very helpful. Thank you.
Thank you very much.
Dr. Kapur, with the cataract, after, about 2 or 3 months, can you splash the water in your eye or not? Some people have got a habit of splashing the water to clean the eye, you see.
Not do anything harsh. Splashing the water on the eye, I will be careful.
Okay.
Your doctor was happy when he discharged you?
Yes.
What did he advise?
At the time, I didn't ask the question, you see, so afterwards I thought about it.
I think you have to be very careful how you splash. You can do it gently.
Yes.
Or you do like this. That makes a lot of difference. I will be very careful in case the
Careful.
lens moves.
Yes, yes.
In case the lens move, give a time of 6 months at least.
Yes.
6 months you should be careful after even minor surgery. I'm not talking about pinhole surgery, you know, that telescopic they do. But I think most of the surgeries, minor surgery, we say minor surgery when we ask you to have minor surgery, we say every operation can have risk. That's why you sign.
That's right. Yes.
So be very careful.
Yeah. Thank you very much.
Dr.
That's what I
Kapur,
said, relative exercise, relative. Don't do that area, do rest of the area. Because if there's no motion, no lotion. And if there's no motion, there is no medicine. Medicine is coming from here. With the
Yes.
motion is the medicine.
Dr. Kapur, what if you've had a major gynae operation? When can you start the exercising?
Now, depends, no, which type of
Then-
operation you had.
I've
Gynae
had a lot.
operation. You had
Had a lot.
hysterectomy, you have oophorectomy, what you had?
And a lot cyst removed, endometrius removed, and
Best thing is,
Total-
I can't
total
talk openly
hysterectomy.
here. I can't talk
Can I?
openly here because I have to ask you a few questions. Please
Okay.
get my number from Mr. Sarwar Podar and you
Okay.
can talk to me. If I am not there, just leave a message. This is a mobile number. The missed call will come. I will call you. Maybe if you ring today, it will be late evening. I'm going out now for
Okay.
holy celebration in the temple.
Nice one. Enjoy.
Please
Thank
call
you. I
to
will.
me. I have to ask you personal questions. I can't
Yeah,
answer
yeah.
in the public.
Well, I didn't really want to ask either, but I thought I might not get a chance. So I just asked. So thank you.
Okay, ji, final prayer.
Thank you. Oh,
Sarve bhavantu sukhina, sarve santu niramaya, sarve bhadrani pashantu, ma kaschit dukha bhag bhavet. Om Purnamida Purnamidam Purnyat Purnamudachyate Purnasya Purnamadaye Purnameva Vishishyate. Hari Om Tat Sat. Hari Om Tat Sat. Hari Om Tat Sat. Om Shanti, Shanti, Shanti. Thank you very much, everybody. Special thanks to Mani. She helped me for the poses. Because it's very difficult. Talking and doing is difficult.
Yeah.
Thank you very much. Thank
Thank
you.
you. Good morning.
Thank
Good
you,
morning to
Prabhuji.
Mohan Bhai and Kausala as well. Om.
Say Om,
Om
Om,
Sarvani.
Om, Sarvani.
Om Sarvani. No, I